officially starting now, so I should officially start. I'm Deborah Lupton. I'm from the Vitalities Lab and also the ARC Centre of Excellence for Automated Decision Making and Society, the UNSW node that I lead, and I also lead the health focus area of the Centre of Excellence and co-lead of the People program. But this event is under the auspices of the health focus area of the Centre of Excellence. So I'd like to welcome everyone here. We have 5 presenters today who have 15 minutes each to speak about their fabulous innovative methods that they've been invited to speak about, which is fantastic. Can't wait to hear everyone. And so they'll be asked to speak 50 minutes and then there'll be 5 minutes of questions. We have a break in the middle, so we have 3 presentations first, then a break, then the 2 other presentations. I'd like to begin with acknowledging that the UNSW is on the Bidjigal and Gadigal lands of the Eora Nation. I'd like to acknowledge elders past, present and emerging, and to acknowledge that these lands were never ceded. If Anthony's ready and all the presenters feel that they know what's going on, great, thanks everyone. Just like to welcome everyone again and thank the presenters. Anthony, are you fine to share your screen on Teams?
Yep.
There we go.
Just starting to do that now. Is that coming through?
Yeah. Fantastic. Awesome. So if you're ready to go, we can get going. I will just get my timer ready and it will give a loud, very loud, it'll give a loud sort of beepy noise or ring or whatever it is at 14 minutes, which means you'll have 1 minute left to wrap up. Yeah?
No problem.
Sounds good. Okay, well, thanks very much. So, yes, so Anthony McCosker and his team from Swinburne University will be the first presenters today. And Anthony, I believe you're going to be swapping over to some of your colleagues.
Yep.
But
yeah, that's right. I'll introduce the project and yeah, we'll go from there. We've got Yongbin Kang and Pete Kamstra as well.
Okay, and you're also working with Jane Farmer and Kath Aubrey, I see, from your presentation authors. Fantastic. Well, please get going. Thanks very much, Anthony.
Thanks, Deb. I'd like to acknowledge that I'm speaking from the lands of the Wurundjeri Wurrung people of the Kulin Nations and pay my respects to their elders past, present and emerging. So as I said, yes, I'll quickly introduce the project. I'm a chief investigator in the Automated Decision Making and Society Centre of Excellence and Swinburne Node Lead. And the project that we're talking about today, I can just get this slide moving. We go, is called Responsible Health Consumer Data Analysis and Automated Decision Making. And it's a bit of a clunky title, but we just want to really pinpoint some of the concerns that we're dealing with around what's generally termed health consumer data, but also the analytical techniques that are starting to be driven by natural language processing, machine learning, and those kind of automated data mining and data analytics techniques that we want to really explore and understand and think about the kind of responsible and accountable elements and ethical elements of those methods. So the team is a fairly big one. These are just the participants, the members of the team who are at Swinburne University. I'll hand over to Yongbin in a minute, who is a senior research fellow and data science at Swinburne as part of the Centre of Excellence. And Pete Kamstra at the end will talk a little bit about the broader context of the project. And Pete is a postdoctoral fellow at Swinburne, but also an associate investigator in the centre. And we have other members present as well. And Kath will come in with our next paper. Now, this project is a partnership with Beyond Blue, Sane and Reach Out, as well as Info Exchange. We're really focusing on the mental health services that these mental health organisations operate, and we're working with them around a project that essentially aims to operationalize mental health data to improve their support services and decision making. And the situation is that they operate, really extensively and heavily used, in fact, increasingly used over the COVID lockdown period, online mental health forums. And we want to help them look at the data that they have, or the data that they generate through those forums, through the forum posts, in terms of geolocated anonymous temporal data, post data, and unstructured text data. Think about what are the potential opportunities, but also risks and challenges in working with that data in order to support their end users, people who engage in their services, but also improve those services. So there's an element here that's about service needs and goals, and the way that we're working this project is very much as a partnership, and including not just the mental health service providers, but also in the end, trying to improve health participation through feedback loops and improved mental health literacy. So it's essentially trying to include the forum participants in the process of understanding how they engage and what it means to them. So at the centre of all of this, and what I'll hand over to Yong Bin to talk about in a second, is a set of methods that we're calling an ensemble of methods, and a kind of data collaboration. So we're working with each of the mental health organisations closely to extract their forum data and to use a number of methods, natural language processing in particular, and Yong Bin will talk about that in detail, but also qualitative methods to triangulate and essentially help to understand what each type of method can give us and can do for improving mental health services. That'll include some spatial and temporal analysis as well. Okay, we think that we can produce new evidence, demonstrate impact and outcomes, and that's a really important part of what we're trying to do, but also fill mental health data gaps. And we've got a huge focus on rural and remote areas, and we're trying to understand resilience and adaptation in those spaces as well, and the role that the forums play in that process. So I'll hand over to Yong Bin, and he can talk a little bit more in a little bit more detail about the specific methods that we're using around natural language processing.
Hi everyone, I'm Yong Bin, and very happy to share some of our research outcomes and predictions for mental health data analysis today. Am I echoing?
It's all good. Sounds good to me.
Okay. So firstly, I would like to briefly introduce the current study trends for understanding online mental health data. So we can group the current study trends into 5 different categories. First one is topic analysis. Some people are interested in topic modeling to capture important concepts from mental health data. Also, some other studies are focusing on psychology analysis. More specifically, they are trying to investigate to identify psychological states of mental health consumers over time. And also some other people are interested in understanding sentiments of online mental health consumers, like positive, negative, and neutral sentiments. Also, another trend is to investigate how to build a term dictionary for representing psychological states of mental health consumers. One representative example is LIWC dictionary, which stands for Linguistic Inquiry and Word Count. The latest version is 2015. And lastly, some studies are predicting online forum posts into different levels of risks. So one example was done by University of Sydney and University of California. They used to reach out data to predict 4 different risk levels from online forum data. like a green, amber, red crisis. So those references are attached at the end of our slides. So you can refer to those things later on. However, in summary, we have found that these three questions still need to be addressed. Firstly, previous research has proven that topic modeling is useful, but how can we actually use the outcomes of topic modeling for improving mental health care services? Second question is, what causes the emergence of certain topics or emotions at a particular time? In other words, there is no research so far clarifying cause-effect relationships between the emergence or prevalence of topics or emotions and events. And last one is, can we see resilience indicators from mental health consumer data? How do individuals build, maintain some resilience from mental health consumer data? So these are the questions that we want to tackle in our research. Next one, please. All right, so this slide shows our mental health consumer data analysis platform. There are 5 steps. So first step is that we collect temporal forum data from a fixed time period with their locations, because we want to analyze the data based on 2 spatial groups, non-metropolitan and metropolitan. And step 2 is to inspect and explore the online forum data. Our goal is to make the data de-identifiable, and we do tokenization and try to integrate the forum data with locations. And we do some basic analysis, like the average number of posts per each quarter time unit, also average number of words in a post, and how many users are there. Also, we try to compare the data statistics between non-metropolitan and metropolitan data. And step 3 is to analyze the data using NLP and ML to get more insight from the data. So in particular, we are applying dynamic topic modeling to identify the evolution of main concepts from the mental health forum data. And step 4 is to build a model for mapping resilience indicators to topics. Topics are here the key concepts we extract from online forum data. This is very important because one of our primary goals is to help the online individuals better cope with their mental health problems and improve their resilience capability. And number 5, step 5 is that based on our findings, so we hope to improve mental health care monitoring and services. And next one, please, Anthony. So here in our research, there are particular 3 questions that we like to address. The first one is how to identify feelings and behaviors of mental health consumers in an urban and rural area. And number 2 is why particular feelings and behaviors are observed at certain time. And number 3 question is, can we identify topics indicating resilience indicators? Here, so in the right side, we see some of the steps we do. The first step is that, as we explained, we do some basic text processing to ensure that we have clean and non-identifiable data. And then we apply dynamic topic modeling to identify evolution of temporal topics. And each topic is seen as a key concept observed from the given online post. Also, we plan to detect events by answering who did what, when, where, why, and how. In particular, we focus on why. Then we like to do some causality analysis to identify what events are making people feel and behave particular ways. And finally, from the topics and causality analysis, we want to identify resilience indicators. And it is our hope that the final outcomes could contribute to improvement of mental health care services. Next one, please. Here, just briefly explaining dynamic topic modeling. So given an online post with some text pre-processing, and we apply topic modeling. And what are the outcomes of topic modeling? So as we see on the right-hand side, the two things. The first one is we can produce topics at each time unit. In our case, we considered a quarter as a time unit. And also, we produce the evolution of topics across the entire timeline by looking at the similarities and variances between topics at each time slot. Next one, please. This is the outcome of the topic modeling. Just the example, so here we extracted 15 topics from the reach out non-metropolitan data set. Its topic is a concept and represented by its top 15 descriptive terms. So let's have a look just briefly. D1 is that people are thinking about other people. And D2 is that people are sharing good, positive news. D3 is that people are trying to maintain good friendship and relationships. And D4 is that people are talking about the daily life. And D5, they are sharing some good feelings like LOL, haha. And D6, they need care and support. D7, they show appreciation. D8, some people are struggling with sleeping. At D9, some people are talking about the event like Christmas. And D10, they are talking about normal life. Also, and D11, some people are showing compassion and talking about the support and needs. So by applying dynamic topic modeling, we were able to understand what major thematic topics are and how each topic is evolved over time. Yeah, also, also we can see the topic prevalence where here we see 4 different topics and their prevalence over time. And as a time unit, we consider the quarter. Next one, please. Also, this is the visualization of the 15 topics, where each topic is represented by its top 5 words, and each dot circle represents a post, and each color represents a topic. So as we have 15 topics, so here we can see 15 colors. In this plot, we can observe 2 things. The first one is that, so we see all posts in each topic are quite closely, cohesively grouped together. And secondly, we see that semantically similar topics are positioned closer together. So this kind of analysis can be drawn from the topic visualization analysis as well. Next one, please. Anthony, next one, please.
Yeah, it's
thank you.
Yep.
Yeah, so here the gray area is actually something we are currently working on now. And for event detection, we are interested in identifying major events by answering, as we said, who did what, when, where, why, and how. Also, we plan to discover solid evidence about the resilience indicators from the outcomes of modeling and causality analysis. So now I'd like to invite Pete, and he's going to speak more about our study about resilience indicators.
Yeah, thanks, Yang-Ben. And I know I heard the buzz, so I'll be very quick. One of the studies we're working on now is using a mixed methods approach. And one of those methods is the dynamic topic modeling that Yang-Ben was just discussing, as well as using more qualitative methods, which I'll explain in just a sec. But the 2 research questions we're trying to answer is, how do these methods individually, or what do these methods individually tell us about how forms help people with resilience? And also, how does an ensemble or mixed methods approach tell us a more comprehensive story about how people that use the forms gain resilience? And last slide, Anthony. Thank you. So the 3 different methods we're using are, again, the more automated dynamic topic modeling approach Yang-Ben just discussed. This gives us these topic trends over time, but it lacks context around the impact that this is having on people. So to find that impact, we use more manual qualitative analysis of individual forum posts to provide that sort of context around those different themes. We're also using semi-structured interviews with forum users to find out their lived experience in the context of the impact the forums have on their resilience. So basically, what we're trying to do is use a mixed methods approach, being led by the topic modeling, to try to see how these mixed methods can tell us a richer story about how forum users can develop resilience. with the main aim, of course, being to discuss these findings with these different organizations. And actually in 1 hour, I'm meeting with SANE to discuss the first topic modeling results with them, just to sort of discuss how these things can help their organization. Thanks, Anthony.
Thanks, Pete. Thanks, Yongbin. That's our references, and I'll just stop sharing my screen if I can figure out how to do that. There we go.
Great, thanks.
And
Thanks,
back to you,
everyone.
Deb.
Yeah, thanks, everyone. So we've got a few minutes for questions. Any questions from the audience? Unless I'm missing some. Has anyone got their hand up? While we're waiting for other people, I've got a question. So I'm not an expert at all on sentiment analysis or natural language processing, but I'm just wondering, I do know there can be some difficulties with interpreting the context of words that can be interpreted, or even groups of words that can be interpreted in many different ways because they could be used in a sarcastic fashion and such. And I'm sure you're aware of all those issues, being experts. So I wonder if you can say a little bit more about how to go about dealing with that. For example, we know in Australian English that the word yeah mate, well, the phrase yeah mate, for example, can be used in many different ways, supportive or non-supportive. So yeah, how do you deal with those complexities?
Do you want to? Oh, I can just jump in quickly because we're low on time. I know. Yeah, it's one of the reasons that I'm always skeptical of sentiment analysis as well, especially for for mental health forums where you just get using the regular analytical models, you get a lot of negative sentiment, and that's just purely because it's talking about the topics are actually about negative issues. So it doesn't really, in the sense that it spits back negative, positive, and neutral sentiment, it doesn't really tell us enough. So this is why topic modeling is about making those semantic connections, and it's just becoming better and better at doing that and grouping and clustering types of posts and types of conversations together. And what we're seeing is that we can really trace and track the way that works over time, not just in a temporal slice, so not just saying these are the topics that are dealt with in the forum, but really what are the things that hit, what are the things that continually are important to people over time, and where does that change? So one of the slides that Yongbin quickly showed was around, showed some really significant change at the beginning of 2020 with lockdown and pandemic issues. And it's really hard to find and surface those things in big data sets. And it's just playing around with these kind of techniques to do that kind of work for the organizations.
Oh, okay, great, thank you. We've got time for another question. There's one from Mark Howard. So Fiona Andrello said she was going to ask the same question as me, so that's good. Killed two birds with one stone. Mark says, can you say a little bit more about the incorporation of stakeholder and end user views in the model design, please?
Yeah, it's something that Pete might be able to say a few words about. He's just about to talk to SANE. We're continually talking to our research partners, and we're working out strategies for including end users, particularly because they work with end users essentially in an anonymous relationship, so they can't easily directly contact or speak with them. Pete, did you want to say something else?
Yeah, for sure. So I guess what we're speaking today, or what I'm going to speak to SANE about today, is just about some of these topic modeling results. And I guess what we do is give them a first sort of a high-level analysis of what we're seeing in order to sort of see what they see, and to sort of compare the two, right? Because it's really valuable for them to provide context for all the different analysis or topics that we see, in particular why they're happening at certain times. But as far as incorporating user views into the topic modeling or the models themselves, I know we had spoken to SANE, but we wanted to contribute or sort of give some of our user interview results back to the people that did the interviews, because that was something they requested. The format in which we're doing that, we're still working out. But at the moment, what it is what Sane has suggested to us is sort of an infographic with just some of the sort of basic results to send to them firstly. And again, inviting people to contribute their feedback back to us, because we don't want to send out the results to the entire forum, because again, that's something we want to avoid. But at the same time, there are sort of subgroups within these forums based upon their different user ranks that have different relationships with the forum itself. So that could be one potential group, like a really experienced user rank could be someone we could provide some results, get some feedback. But I think the first step will be providing an infographic to the actual people that we interviewed to get their feedback. That's the first step.
Oh, that sounds like a really interesting approach. Yeah, I'm sure many of us will be interested in following up how you're going to bring all these different methods together, because it's a fascinating approach you're taking. But thank you for now, and I'm sure people who want to follow up with you, by all means, I'm sure you'll be happy to have emails from them if they want to hear more. But we need to move on to the next. Thanks very much, Anthony and colleagues. And we'll move on now to Kath and colleagues. Kath, are you okay to be sharing your screen? So Kath is going to be speaking also with, she's also working on a project with Anthony.
Sorry, giving me a hard time on the share content.
No worries. I'll just keep talking while you. I'll just keep you while you do that.
Yeah.
So Kath is going to talk about a project that Anthony's also working on with her and Zara Stardust as well from QUT, and Nick Souza from QUT, and Joanna Williams also from Swinburne. Oh, and I can see that.
Great.
Kath?
Good. Okay. So yeah, this is kind of segueing onto that last piece of discussion about how do we give feedback or test findings, I guess you might say, with partners in research. And I'll briefly talk about the current project we're working on, or the project we're starting up as part of the ADM+S. And then I'm going to talk a little bit about the methodological approach with reference to work we did in the linkage project that Anthony and I and some other people just wrapped up. So this project for the ADM+S is looking at the impacts of automated content regulation on content creators who work broadly in the space of sexuality, education, and sexuality and reproductive health information. The discussion that we've had with the partners has made it clear that education and information are seen as slightly different things in this context. But we are looking at both. So we're looking at the ways that both sexual and reproductive health educators and funded organisations, government and non-government organisations, are experiencing the impacts of content moderation on platforms primarily like Instagram and Facebook, but potentially other platforms too. But we're also looking at the impacts on broader kind of what you might call content creation communities. So people like influencers on TikTok, for example, who talk about their subjective experience of sexuality and identity and gender and these kinds of things. Currently, we know anecdotally that organisations and individuals globally are having a very difficult time negotiating with platforms, and that a lot of their frustration is relating to automated content moderation. But there are not great channels of communication between the platforms and the organisations themselves, and we're not sure how well the people working in this space understand the rules and regulations. And Joanna Williams, who's also on this project, is doing a PhD with me looking at some of the experiences of organisations in Australia, but also internationally. So we're working with UNESCO on this. We also have some collaborators at the Institute of Development Studies in London, Pauline Osterhof primarily, but also Susie Jolly, who's an independent researcher and has done quite a lot of work in China in the space of sexuality education. And we're also in conversations with a group called Youth Tech Health, which are a kind of philanthropic startup hub in California. So I'm much closer to the kind of heart of Silicon Valley and platform land than the other partners on the project. And the aim is to, as I said, bring the platforms themselves into dialogue with content producers and hopefully develop some clearer senses of how content regulation might work better in this space. UNESCO is also developing a community of practice for content producers and will be involved in working with that community of practice in terms of informing and expanding their work. So this project is just starting out, I should say, and it's in terms of methods, pretty conservative in many ways. It's going to be a survey and some follow-up interviews. It's not especially innovative, but when you asked us about this project, what I thought I might talk about is the process that we're carrying forward from our previous project, which was an ARC linkage with ACON Health and Family Planning, which involved several layers of collaboration with professionals, you might say, in the space of public health, as well as and education, I should say, and information sharing, health information sharing, health communication, as well as end users of apps and platforms. And the reason I thought I'd share a little bit and talk about that a bit today is that as I've looked through methods papers, as one does, to try and reverse engineer the narrative of what it is we exactly did, which you do when you're trying to publish things often, I haven't found any literature that really speaks to the various threads of collaboration that we brought together here, or the partner building that we did. And Anthony's going to jump in as well, potentially if he's got stuff to add as we go along. So we had several levels of collaboration built into this project, and it's a model that I conceived of based on some of my history as a member of project reference groups for New South Wales Health and for small organisations like ACON Health and Family Planning in the past, which involved projects particularly relating to HIV, health prevention and health promotion strategy, prevention and health promotion strategy, and also living well with HIV, that involve very broad interdisciplinary consultations with academics from a range of disciplines, from epidemiology to social research to, in my case, media and communication, to people in affected communities and people who might be termed kind of community connectors, or people who did not have a formal role but were very engaged in community communication around sexuality and health. So in this project, we built up multiple levels of collaboration. As I said, the project team met very regularly with the PIs or partner investigators from ACON Health and Family Planning. And we had monthly or at least 6-week frequency of meetings in the project planning stage. So in terms of research design, we did a lot of sense testing and problem posing, sense checking, I should say, and problem posing with them around the design of the project, around survey design and qual research design. But beyond this team of PIs, we also put together a range of project reference groups from the very start of the project. One was a group of professionals across sexual health and youth services, and we asked our partner investigation team to suggest people, but we also approached people that we already knew. So these were people from youth work umbrella organisations, they were health workers, they were mental health workers, and there were also some policymakers and some quite senior people in this group. Later in the project, we put together an additional professional reference group comprised of specialists in trans sexual health and wellbeing, because we recognised that was a gap in the initial scoping of the project. We also had a reference group made up of LGBT+, Q+ app users, dating app users. And we also had a group of straight dating app users. And we met with these groups remotely using a focus group platform called Focus Group IT. This was pre-COVID, so initially the project was scoped for face-to-face meetings, but when I moved from UNSW to Melbourne, we realised that it was no longer practical to meet face-to-face with New South Wales groups. And it was a really useful way of consulting with focus groups, or I should say reference groups in this case. And actually I would use the platform again, even in geographically proximate places, because it's a very simple platform to use, and it's not a very pretty platform, it's very basic, but it allows you to share documents and audio files with people in the discussion group. It allows you to export transcription of the chat as either Excel or PDF files. So it's very useful for exporting into NVivo, for example, or exporting for qualitative analyses of different kinds. And we had ethics approval to keep these transcriptions, and we negotiated this with all the participants in the project. And we consulted with these groups quite regularly through the process, at least twice a year with each group, sometimes more frequently. In the early stages of the project, definitely more frequently. And we also had an interim consultation with what we called the Critical Friends group, which involved people who had not been members of this initial professional group, but who we thought would have a really good strategic eye to what would be most valuably communicated in the final report for the project. And this approach really was about strategy for us in some ways, because it was a linkage and the aim was to create outputs that could be practically used and adapted by educators and by sexual health professionals. We were very mindful that the research questions that we were interested in as media and comms scholars were not necessarily questions that professionals in the field of health promotion or clinical service provision might be interested in. So we did a lot of communication with the groups in the early stages around how we might shape the research questions and the research communication. And we've been doing that work as well on the current ADM+S project. And we also asked many questions about how we might best communicate early findings with the reference groups in order to elicit really meaningful feedback for us. So one of the things that became clear early on is you cannot ask project reference groups, even project reference groups made up of non-professionals, to do a lot of homework before a consultation group. So if you're doing any more than the show and tell mode of reference group shaping, which some people do, you know, a reference group is just to kind of take the temperature. This is what we did. What do you think of this? Get some feedback. In our case, we actually wanted to shape research questions through dialogue with these groups, and we actually wanted to have a bit of an in-depth back and forth. And so we had to really learn and negotiate how to best communicate preliminary findings, for example, from the desk research in our project, in a way that was meaningful and would elicit useful conversation and might actually, for example, push our project in a different direction, which is what we wanted. We wanted the potential to be challenged in the communication. So while we did share a very brief one-pager of a literature review that Paul Byron put together on the ways dating apps were discussed in public health literature over a set period of time. You can see 2015 to 2018, what the key themes were, what was and wasn't covered. We did not expect people to read that literature review in depth. It was not, we knew full well, this is not a tutorial presentation where people are expected to do the pre-reading. They are, the professionals were meeting during their work time with the consent of their managers, but it was taking an hour out of their day. So we presented lots of documents in graphic form, not particularly pretty or fancy, but very easy to grasp the key themes as much as possible. We also discovered, and this was unplanned, but a joy of the focus group IT platform, we discovered that there was a polling function. And so we shared a group of 12 options that might be kind of some key research questions that we would really tease out in final reporting and ask the different reference groups to vote on them. And we then shared back with the 3 reference groups after we'd met with all 3, again, a kind of graphic sense of how different people had voted, and asked them to reflect on why they thought, for example, you can see here in the middle, the relationship between dating apps and communities was a high priority question for LGBTQ plus app users, but a fairly low priority question for sexual health professionals. And so we were kind of eliciting data as much as we were sharing data here. And similarly, you can see more polling. So I'll just wrap up, and Anthony might want to chime in this final minute. In terms of thinking about partnering and doing this co-design work with project reference groups, I guess the key, what I would term methodological takeaways are, it's really important to come bearing gifts. You need to share existing research and knowledge, but do not expect people to do their homework or do pre-reading. And this is a fine balance to strike. You need to be very strategic. So every meeting that we conducted combined problem posing, sense checking, and also knowledge translation. So, you know, this is what we gleaned from the previous meeting, or this is what we've gleaned from our initial interviews. What do you think? Is this clear? Would this work for you in a professional context? We also, and this is part of the come bearing gift, we made ourselves very available to contribute, to speak to the board if they wanted us to meet with the board, to contribute to panels that they were putting together for conferences or internal events, and to answer questions about the research. There were lots of surprises and in some cases annoyances that, you know, we probably pissed them off, they pissed us off throughout the project, as it is with any relationship, and we basically sucked it up and did not, tries to be as frictionless as possible in terms of this. And this was a prolonged relationship. It was a 2-year relationship here, and we were really going for as a, you know, a really respectful relationship. We tried, of course, to be patient too, and really respect the pressure and the distractions that people were doing, whether they were meeting with us in their personal time or in their work time. And we always tried to develop strategies for acknowledging contributions. So for the non-professionals who were not in the reference group as part of their job, we provided honoraria. We wrote references for some of those people because there were people trying to go into health and allied fields. It's why they joined the group. So we kind of wrote letters back to them at the end of the project, acknowledging their contribution. For the professionals, we provided a lot of information to their managers if it was requested. And in terms of both the report, the project report, and some of the publications, we've made formal acknowledgements and named people, and we've co-authored with some of the reference group members. Also, we have not acknowledged people where they did not want to be acknowledged or where they wanted to informally be involved in the project, but being a formal project member was just going to get them into lots of trouble. So there was sensitivity, I think, to the needs of the partners first and foremost. I don't know whether you want to add anything to that, Anthony.
No, that's comprehensive, but I can't stress enough how important it is when we're dealing with trust and technology and that's what these projects are about, is the collaborative and participatory methods, and I think there's all sorts of lessons that we're still processing from each of these versions of that. So there's lots still to work out, and part of that is about the role of intermediaries, whether it's in health, sexual health, or working with young people in translating the work that we do and translating research and operationalizing it in the world, which is the way that we think about it.
Awesome. Yeah, thank you. And so these are just some of the literature that I've found useful for thinking through this process. And you'll see it's not all from the space of public health. Some of it's from the space of tech design and human-computer interaction, because as Anthony was saying, some of this is around kind of translating ideas, concepts that are more familiar to people in the tech space in dialogue with some concepts that are not familiar at all to us in the tech space or us in the social research space. And I think it takes a really multidisciplinary approach to think it through and talk it through. And I think I'm still working out how to explain this as a method to other people. So I appreciate being part of the presentation today. Thanks.
Thanks very much, Anthony and Kath. I mean, it's really great to hear about your long experiences there with community partners and stakeholders, because as you've gestured to, like, can be a very fraught experience, and it's really great to hear how you've successfully managed the process and made sure they've had a voice and a real valuable role. Are there any questions from anyone? Can't see any questions yet. Just looking for any hands up as well. I mean, just a comment, I suppose, from me is that, I mean, I'm aware too that things can get politically fraught as well. And I know of colleagues, not in our research centre, but outside in a different area, who've basically been told by a public health body they were working with that they weren't to reveal any of their findings because they were politically contentious. Have you got any advice as to how to deal with that? Very difficult. I don't know if you've had experiences yourself. I mean, you're obviously working in a very politically contentious space anyway.
Yeah,
sexuality.
We did lots of brokering. So, and because I think that I've been doing work with sexual health partners since about 2006. So I'm very aware of the potential for politics and for landmines. And I don't, it's an ethics question too. I don't want to burn the partner organization in the same way I wouldn't want to damage an individual's kind of well-being or welfare or employment. I don't want to burn the funding for an organization that is funded by the Commonwealth. So some of the conversations and presentations and reporting might have a different focus for an in-health face-to-face, an in-house face-to-face meeting than for a public publication. And yet, on this project, there wasn't anything we couldn't say, but there have been other projects where, we thought about what findings are useful for the organisation, and that was provided to them as a private or in confidence report, and the public findings were phrased slightly differently.
Yeah, and I guess it also starts at the very beginning with choosing your partners wisely, and maybe having a good sorry.
And also being really blunt, like not blunt in a rude sense, but blunt in a pragmatic sense. Like, I understand there will be political issues for you. Universities work differently to your organisation. I need to, we need to keep checking in, and we did this continually. Like, is there anything you need from me in terms of reporting and feedback? Is there anything that I shouldn't say? Is there anything, la, la, la? And just be really frank about that, and be very aware. We did a lot of conversations, and we always do, is there anything I shouldn't say? Is there anyone I shouldn't talk to? As well as, what can I say? Who should I talk to?
So a lot of it is in the initial setting up of the partnerships, as you say. And what about in terms of, and I've just noticed Simone Fulligar was saying she also was interested in these issues, so that's great. It's not just me asking these. What about in terms of academic publications? Do you always go back to the stakeholders to have them vet anything you think might be contentious about their organisations before you send them off for review? You do?
Yeah.
Yeah.
It's often a contract to do that. That's usually the arrangement. Yeah, and I mean, I've had work held up for 4 years with federal government, waiting for final sign off from the minister, and nothing could come out until that point. So it was every paper had to kind of go through the same sort of process, and with some contentious elements that had to be sort of mediated, and you have to convince them that this is important to say, even though it doesn't quite fit your narrative. It's still important knowledge-wise. This is the stuff that we need to know, and it's about how you frame it, I think.
And that's also the thing too, where some organisations will say, an individual will say, I'm going to be involved in this as an individual with knowledge and expertise about this organisation, but I want to be very clear, my organisation is not a partner on this research. And we'll all go, yep, good. And in that way, they're part of the advisory group, but actually they're as much of a, in many ways, you're developing content for them and for their organisation as well. And if they're not funding, that's generally fine. That the real complexities are where the partner is the funding body as well, or co-funder.
Yeah, really valuable insights. Thanks very much, Kath and Anthony and colleagues. So we'll move on now to the next presentation, but thank you again. So Anna Hickey-Moody, are you okay to share your slides?
Hopefully. Let's see how I go.
Okay, so I'll introduce you while you're trying to get it to happen. And just, Anna's in a rural area where her internet isn't as good as perhaps some of us, although I know that even in Sydney, some of my colleagues have troubles with their internet. But anyway, that's the NBN for you, isn't it? So Anna's from the Digital Ethnography Research Centre at RMIT, and she's been doing some really interesting work into faith-based research with young people, and so that's what she's going to focus on today in relation to digital health, which I'm really interested in hearing about. So Anna, how are you going?
Thanks, Deb, and thanks for having me. It's saying it's loading, but let me just try. I'm going to try one more time. So I'm just going to do, because normally it does it pretty easily, and the fact that it hasn't is awesome. I'm just going to try one more time.
Yeah, sure.
Screen. Is it? Can you see my screen now?
I can't.
Can you see a slide?
No.
You can't.
I just, oh, now I can. Yay. Here we go. It's all good.
Okay. Can everyone see it? And can people hear me?
Well, I can. And somebody else says, yep. So
Awesome. Thank you. That's great. I was saying earlier that Last week, I just decided to work from home in a different location for a little while because I'd had enough of working in the same room for about 24 months. And so please forgive my internet connection. I'm on the lands of the Yuin Nation. They're stolen lands, and I'm really lucky to be here. It's a bit sunnier than Melbourne, and I just really needed a sea change. And thanks so much, Deborah, for having me along. I'm so glad that Jacinth is here. And Deborah and Jacinth and I have spoken about this project a couple of years ago. This is a project that I've been working on since 2017. And I'm going to tell you a little bit about the pilot empirical work that I had funded and undertook. And I want to just sort of reframe the idea of me giving a paper briefly, because what I'm doing is talking about a project that's been bubbling along and has had some funding, and there is a clear need for the project to be developed, but I wanted to workshop it with you all, and that's what I've taken the opportunity to do. And so rather than presenting my answers or my findings, I'm explaining a research story and really genuinely inviting thoughts and contributions and involvement if that sort of ends up happening. I just decided to be brave about it. So it's an open, emerging story rather than a completed story. So there is a need in the digital health sphere to develop faith-sensitive approaches. And this is very much a project that is about the young people that are not on digital health forums and the young people that are not using apps. The Mindspace, the Headspace app and the Beyond Blue forums reach some demographics and very much don't reach other demographics. And part of this is questions of cultural safety. So ideas of mental health, like the concept of mental health, is very Eurocentric and isn't seen as a culturally safe kind of idea for some of the young communities that I was working in for 4 years during my Future Fellowship. And also youth sites and spaces are seen as being quite particular to Anglo-Saxon culture in some ways, like youth cultural resources or youth hangouts and youth spaces are framed as being broadly for sort of secular culture. And understanding the ways in which we might open up digital health resources in more faith-specific ways is something that I think needs to happen. And I've sort of found this both through, so in the communities that I was working in for my Future Fellowship in Sydney, in Western Sydney, there were a number of suicides of particularly religious boys in 2017 and 2018. And some of the community groups were talking about the fact that it's really difficult to provide mental health to these youth communities. But it seems to me that there are also very limited kind of pathways to access. And part of it is because the digital cultures that young people have aren't very well understood. And they're not about mental health practices, is that the digital health apps really presume a whole kind of subjectivity and relationship to digital cultures that isn't actually the way that these young people engage with technology. I mean, most of the young people that I was working with, the teenagers in the pilot study all had their own devices, and none of them used their own devices for health practice, well, for what might publicly be considered health practices. So I decided to try and put a linkage together, and this is some of the text from the linkage that I've been working on for many years, and is still sort of in the in-between space. But I'm interested in barriers to accessing mental health resources. And I have to say that I think that the concept of mental health is one of the barriers. And I think that if there was a suite of digital health spaces put forward that are designed for faith-specific communities, they would have to not necessarily be around the concept of mental health. But I think that there could be a lot of ways that we could create digital resources and digital spaces, or that digital spaces could be created that would be really useful for faith-specific cultures that weren't sort of sold as mental health for youth. Because I think that part of what I want to do is understand the problem of the concept of mental health for youth for certain cultures, because my research has shown me that there clearly is a big barrier there. So these were the sort of research questions that I've been thinking about. And I spent most of 2018 kind of building partnerships to answer these questions. And my partnerships in community were really, really strong. So I had partners in the Brimbank Council and the Brimbank area who these sort of research questions come in to the Brimbank Council's youth strategy and also mental health strategy. And a lot of community organisations are interested in undertaking this kind of work. And so the Cumberland Council, which is where I've been working since 2016, especially in Auburn and Blacktown, were incredibly supportive. And the Cumberland Council was my second partner. So I had the two partners, and then TAFE, Cumberland TAFE, and a community services organisation, all of whom had a lot of trouble engaging teenage youth communities in kind of mental health projects because of the culturally unsafe nature of mental health. But I really struggled to bring partners like Origin Youth, Sane and Beyond Blue on board. I had meetings with Origin who were really interested, but who were also kind of like, I can't see this is going to make a lot of money. I'm not sure actually what they thought. They were really interested and weren't really sure how that would sort of fit in with their agenda, I think, because I suppose I'm not trying to be critical of the notion of mental health. I'm trying to translate the notion of mental health into a useful space and idea that has a different name. And in order to figure out how that process of translation might work, I wanted that needs to come from youth communities, and it needs to be grounded in the communities that are obviously going to, use the resources or inhabit these spaces. And so I don't think I could sell the translation project effectively enough. I'm not quite sure. So I had a full draft of my project together, and I was talking to the research office, who said to me, "This is looking too medical. You can't put this in." And I said, "Oh, it's not medical though, it's sociological." And we had this kind of conversation, and I panicked. And they said, "No, you're not. You're going to be pulled up on the researching sort of medical outcomes." Which, as we know, RMIT had an issue with that at a particular point in time, and I think that the research office panicked. And then since then, my senior colleagues have said, "Anna, what's happening with this project? I think it's really got legs. Where are you going with it?" And I am, and I'm returning to it and trying to overcome my fear. So it's clear to me that in the young communities that I have worked in, so I received some pilot funding, and I worked with Mia Harrison, who's at the Centre for Social Research and Health at UNSW, and Mia worked with me for a number of years on my Future Fellowship project, I think from 2016 until she got her postdoc recently there, and also Marissa Wilcox, who is still working with me at RMIT, to run a week-long pilot study in the Cumberland Council area in Sydney. So this was in 2018, around understanding the teenage sort of mental health relationships with digital devices, and mental health is used very broadly there. So I basically wanted to understand kind of the feeling happy online experiences, and these were for the kids that and understand some of the critiques of mental health, and that was really interesting. So that I partnered with the TAFE, Cumberland TAFE, and did some digital animation and digital mapping workshops with the kids, the teenagers there. And so I started then thinking, sorry, there's a bit of a logo overlap there. Then my slides moved a bit. So I basically got a bit of a sense of their relationships with their technologies, and realised that's where I started to understand the fact that their digital worlds were very much about feeling good and community and health in a whole range of ways. However, however, the concept of mental health was stigmatised, and part of that, I think, relates to some divides between secularism and religious culture that are not necessarily articulated that clearly, and that are certainly around culturally appropriate behaviours and culturally safe behaviours and fitting in. And so I was starting to think about how I might understand this better in a larger scale. And I wanted to really through a much sort of more extensive mapping of young people's lives online. And I think that I would be really interested to examine, to do a larger set of young people exploring their digital worlds with me, not just in, I did a group of 10 TAFE kids over a week where they told me their stories about what they did on their phones, and I brought iPads with me to have a look at what they were interested in and what they found pleasure in. But I was really wanting to understand how, from the ground up, how their worlds came alive online. And I think that the ethnographic context is very important in the respect that it shows the value of, for example, like the financial value of the kinds of phones that young people have, the kinds of importance that's placed on digital devices in different cultures. I think that sometimes for example, like the recreational or the community activity that happens online has a much higher or a much lower regard in different young people's lives. And certainly some of the girls that I was working with were much more interested in their offline. They thought that their offline communities and kind of conversations and gatherings were more significant for their well-being than their online worlds. And the boys were also very invested in, some of them in sport cultures and some of them in gaming online cultures. And at the time, Fortnite was quite popular with the teenagers. They were sort of 16, 17, but they were still really into online gaming as a sort of a social activity. So anyway, this was what I was thinking for my designs, and I wanted to explore ways of interacting with young people online and thinking about how religion orients relationships to screens. There's a really great essay called "There's No Such Thing as a Depressed Muslim" in It's Not About the Burqa, and it really was just it shows up a lot of the things that the young people were saying about how mental health is constructed. So yeah, these were the kind of methodology and research questions that I'm looking to explore. And I'm looking to try to inform policy and obviously products. However, this is kind of where I'm at with things, and I'm really keen to have people who are involved in collaborating, or who might know people that want to be involved, or organisations that want to be involved. Because as I've said, I've got some partners, but I don't think I've got enough substantive investment to fund a linkage. And I can see that this is a space that has been identified by a number of community groups as needing work, but I think that it needs to be kind of consolidated. And so I wanted to just sort of open up that conversation a bit. Thanks.
Great, thanks, Anna. Yeah, I remember having a conversation with you a couple of years ago about this project. It's a really, really interesting project. And I guess what I would say in the first instance, and I'm sure Anthony and Jazz Flore would probably have something to say, and Simone as well, and other people on this session, on this workshop, about mental health research space. It's a very, my experience of it is it's a very fraught and political space in terms of people wanting to own it. But anyway, I'll let others also comment there. So Anthony's got a question. Have you thought about DHHS or other Vic Health options?
I did have one really great meeting actually with a woman from DHHS there, who was a psychiatrist, but I think Vic Health is a great idea. Thanks. And I agree, and I really don't want to own mental health. I don't even want to be a mental health researcher specifically. I want to try and bring faith-specific knowledges into the health space in a way that mental health researchers who own the space can change the space, if you know what I mean. Like, I definitely don't want to. I don't want to take on problems. Simone, do you have your hand up?
I do. That sounds like a great project, Anna, and I think you really need to do it, because you can bring such an interesting perspective into troubling all those dominant ways of thinking about mental health. And I wonder if your pedagogical background also gives you maybe a way in or a way around that whole issue around medical research outcomes, and trying to avoid being positioned in that, by thinking about the whole problematic of mental health literacy, which is, how do we produce knowledge about mental health? And, it's embodied and it's cultural and it can be creative and all of those things. So it might be worth picking up on some of that more critical work around mental health literacy to think about how it can be done otherwise. Because there's definitely, lots of space there to create other knowledges and explore what those cultural nuances are.
Yeah, that's a good point. Thanks. And it's literacies for whom, isn't it? Like, the mental health kind of communities and discourses are so specific. Sorry, Jazz, you've got your hand up, haven't you?
Just a very quick thing, Anna. Firstly, I second what Simone said. I clearly remember talking about it with you, and yes, you should totally do it. It was such an interesting, I remember the workshop from way back, and it was such an interesting day that we had. I was going to say, the point that Simone made about education is really good, because that's a way to sidestep the whole, you're doing medical research, you shouldn't be funded by the ARC, that I went through as well. Because it can be very creative and you can frame it quite differently. And it's also a way to counter some of the more clinical narratives that there are around, what is mental illness, what is mental health, that sort of stuff.
Thanks. That's a really, really good point. And I think that another, which I think has purchase, is talking about feelings. And I don't know if you can be mapped onto health broadly, and are also I think that they can still be considered the domain of the humanities and social sciences, because feelings, especially as a sort of a methodological focus point, affect studies and feelings, I think can still be owned not by medicine.
You could call it emotional safety.
Yeah.
I wouldn't be too worried about the medical overlap, Anna, because I mean, myself and many other people, health sociologists, for example, constantly get funding from the ARC. It's actually quite easy to show that, you know, it's not going to go beyond their borders. So I actually wouldn't be too bothered about that. Now, just a last question from Georgia Van Torn, who's put it in the chat. She says, thank you, Anna. That was really fascinating. I'm interested to know if you have any thoughts about what ideas or discourses other than mental health would translate better. And I must admit, I was also thinking in relation to that, Anna, that maybe talking about well-being more generally rather than mental health. I got the sense from you that that actually might be more of your focus.
Yes, I think, well, I think that there is a crossover, though, between well-being and, I mean, the communities that I was talking to had suicides. And so there's clearly a point where well-being, I completely agree that I'm talking about feelings and communities online, but I think that when things, that there is a problem, that when there are serious mental health issues, there are either no ways of talking about that or acknowledging it, or that there are ways of fixing mental health. So I have qualitative data that is about experiences of serious mental ill health that is being fixed through non-medical means, and that is because mental health is not seen as a culturally appropriate space, and it sort of doesn't work, and that's why the boys died. So I do think that there are sort of in between. It would be good if there was a possibility to move into service provision that was faith sensitive. There is clearly a big not meeting point between the mental health service provision and Orthodox religious communities, and that's part of what I'm trying to draw attention to. And I think so, yeah, Georgina, thanks. I think that well-being is obviously a different issue, but I think that there are much more specific versions of well-being that are what I want to find out. Is that that there are. I want to try and find out the limits of being able to connect with medical discourses and how they are informed in different religious communities by religious beliefs, if you see what I mean. And that's something that I can't have the answer to. That's something that has to come through the empirical research with communities. And I think that's something that the industry would broadly benefit from, but remains unknown. So you're kind of asking the same question that I'm asking, I think.
Yeah, it's really fascinating issue, Anna. Thanks for presenting that today. I think that's probably raised a lot of really interesting ideas in everyone else's heads as well. If anyone wants to any feedback to Anna, maybe email her. But we need to take a break now. Thanks again, Anna, for your presentation and for people's comments.
Thank you.
For that, Jazz. I just wanted to acknowledge the country that we're on today. So Jazz, Alan and I are on unceded Wurundjeri land here in Melbourne or Naarm. And obviously we'd like to pay our respects to any Indigenous people who might be here today, as well as to elders and custodians present, past and emerging. And I suppose in addition, to an acknowledgement of country, I think it's a really good opportunity for us to just kind of, take a moment to reflect on, I suppose, the deep time of culture and knowledge production in Australia that's always existed here, much longer than the methods that we're going to maybe talk about today. And I think, yeah, it's just a really good practice to kind of engage with those those deep lines of knowledge production that have existed here for a long time. And I feel like it's the sort of thing that sometimes can be hard if you don't know where to begin learning about some of these things, or you're sort of not sure how to jump in. And I think a lot of work that we have to do as people is just to kind of jump in at some points and educate ourselves. And so I'm not affiliated in any way with this publication, but I just wanted to share it because I think it's really wonderful, and it's only just come out, and it's a whole series of editions that are Indigenous led. So the editor of the series is an Indigenous curator, and the series is called First Knowledges. And so the first two books, this one's called Design, Building on Country, and it's Indigenous perspective. Yeah, great. Yeah, awesome. Fantastic book. And then the other one is called Songlines, which is really beautiful. And I'm almost finished this one at the moment. And I think what I'm really enjoying about this is just I suppose, the power of storytelling, and storytelling as a knowledge system, and as a method for producing and storing knowledge and kind of connecting people to each other and to place and to things. So I just think that's the sort of stuff that can be good to talk about as researchers, like how can we learn more? Anyway,
yes, it's a really great series. I've got both of them too, and I'm keeping a close eye on the next volumes that are coming out. Yeah. So Jazz tells me she can't share your screen. Is that right, Jazz?
Yeah, I don't see the option actually. I don't know if it's the privilege issue here.
So I don't know if Sally's stories. I know Sally. Oh, so you should. So you can't see a little arrow, top arrow, next to your microphone.
Oh, that's a 2 option. Yep. Okay. Here we are. Can you see my screen?
Yes.
Yes.
Yes, I can see it going through the slides now. So while you're just finalising that, Jazz, I'll just introduce you guys. We've had an interesting pre-conversation about Indigenous knowledges, which is great, and sharing that information about those book series. But let's get on to your talk. And so we've got Jazz Choi, Kate Geck, and Alan Nguyen. Sorry, Alan, if I've mangled your name.
Oh, no problem. That's quite good.
Oh, well, can you tell me what the correct pronunciation is?
It's Nguyen, but
Nguyen.
Yeah, that's great. Thank you.
Okay, thank you. Sorry about that. From the Careful Design Lab at RMIT. So go for it. Who's going to speak first? Is it Kate or?
I'll start.
Jazz, all right, go for it. Thanks very much.
Thank you, Deb, and thanks so much for having us. We're going to present to you one of our new projects called Polyphonic Motions, and if you look at this is how the project is officially briefly described. And of course, this can be done in any different ways. And taking the spirit of workshop to our hearts, we wanted to open up and sort of talk about how we're hoping to do it at a broader level, and expose both its potentials, vulnerabilities, and invite your thoughts, really importantly. And that is also fundamentally our approach to doing research and practice together. So if you have read that quick description, and how we approach that then is within the context of automated decision making. I guess it's rather like data outlier. That's the one in red circle. Algorithmically, with this sort of data, we would often discard this data outlier. It's an anomaly, it's an error perceived to be irrelevant to what we're talking about. But we see it as the most exciting and the most actually important than the clusters here, where patterns can be deduced, described, and applied quite easily. And the question really for us is, what if we recentered and started with the outlier and try to sense and make sense of the constellations around it, be it data, theories, context, the social, technological, environmental. And we've been doing this for a while across different projects. And for us, it tends to take quite a bit of convincing different stakeholders as we're trying to draw attention to stake seekers. Who are mostly invisible and ignored, and iterative work, both in research and practice, but also very often advocacy for the existing and potential outliers within and beyond the project. So to go on this journey, we need a few things in our carry bag. And one of them is multiple perspectives, experiences, and skills. So here are our core team. The post-its, as you can see, are some of the shared sort of interest and experience in our research and practice. So briefly with myself, I'm Jazz Yijong Choi. At the moment, I'm the feral creature, also looking at engagement and how engagement is understood and can be done, especially for eco-socially transformative creative practices within an EU Horizon 2020 project's creatures. I'm also a principal research fellow in design, and I've been working quite a bit in participatory design and urban informatics. And I'll hand over to Alan.
Hi, I'm Alan. I'm a writer, director, and designer of film, television, theatre, and interactive digital media experiences, including virtual reality and other extended reality technologies. And I've got a background in music and sounds. Yeah, I'll pass it over to Kate.
My name's Kate. I'm an artist and I'm an industry fellow in interior design at RMIT. And I'm undertaking my PhD at the moment looking at somatic extended reality. So I'm really interested in, I suppose, the different thresholds that kind of emerge between the body, between digital and between physical space. And I've done a lot of work with Fog Theatre, who are our partners on this project, as well as spent a lot of time as a community cultural artist with at-risk young people with various organisations in Australia over the last 10 years or so. So yeah, I have my own art practice, but a big part of my practice is also working collaboratively with groups who may not have the opportunity to work with technology in their artistic practice for very obvious reasons, mainly barriers to access and things like that. And we also have a few other people working on the project. We've just engaged Anne Wong to work with us as a research assistant. We have Siobhan McCarthy, who's just about to begin her PhD looking into speculative design. And we're currently seeking a creative technologist with experience in machine learning, which is kind of a core part of our project. So I mentioned Fog Theatre just before. And so Fog Theatre are a really incredible collective of artists who have intellectual disabilities. And all the people at Fog have backgrounds in performance, theatre, movement making, and a number of those artists are also fine artists. They have painting and drawing practices as well. And so Fog's been around since the mid-90s. They were previously run through the St Kilda, I think City of Stonington is the St Kilda local government area, but they've recently been incorporated into a new independent organisation called Vitae Veritas, which is run by Nilgan Govan, who's a theatre maker and performer. And she's worked with the Foggies for many, many years. And so I've worked with the Foggies for about 3 years on two projects, bringing projection technologies in with their movement practices. So this little video, maybe if the sound is really low, because it might be a bit, I can just talk over the top a bit. But this is the first project I worked on the Foggies with, called Signature. And it was a guided meditation that Fog Theatre produced. It looks like I've got bad network quality, sorry. Hopefully I'm not cutting up too much. But the idea with the Signature theatre piece and meditation was to produce a guided meditation by artists with intellectual disabilities or artists with intellectual disabilities. And so the way this meditation unfolded was quite kind of, yeah, I suppose unique. And so we engaged in a lot of drawing practices and movement practices to produce this work. So the Foggies created all of the textural, or a lot of the textual projections through their drawings, which I then animated. And the thing that really struck me in this production was this idea of the signature movement. And so at the beginning of every workshop, we would start with like a movement warm-up, which is really common in theatre circles. But on this production, each member of Fog Theatre had their own signature movement that they would do and perform. So you can see on the screen, this is Clem, and his signature movement was to kind of move his arm down. And this is Lachlan, and his movement was to kind of like circle his upper body and head. And so as part of that warm-up, we would have to kind of engage in these really specific bodily movements that were kind of specific to each performer. And I suppose one of the characteristics of the Fog performers is that they have these really, you know, there's a range of really discursive physicalities. Everyone has a really particular range of motion. And so that really kind of struck me that, you know, particular movements had pleasurable aspects, and that we could kind of engage in those and maybe access some of those moments of pleasure and kind of appreciate the movement, the internal felt experience of other people's movements. And so that sort of has tied into, or kind of platform part of the project that we're working on now. So Alan, do you want to talk about the prototype?
So we're also drawing from our previous work. We developed a prototype and it was a pilot project called Musical Motions. And we were really looking at how to encourage healthy emotions in age diverse populations, particularly elderly people and particularly people from migrant populations. So we were thinking of encouraging these healthy emotions by making them more sensorially joyous and fun, and also social. So we developed this prototype that converts physical movements to music, so that non-musicians, while they're doing healthy exercises that might encourage balance, will turn into music. And when more than one person joins in, then more music is created. So that's something that we're drawing from.
So going back to then looking at what we've been doing and going back to how we might start from the data outlier perspective. So elsewhere, we can sort of see whatever we might end up designing, and there are multiple forms of design artifices and artifacts anyway, at the end of the day. It doesn't matter wherever you might start on this diagram, the impact would be felt throughout the entire space here. Obviously, we stopped at the city level. It is adopted from Danny Hill's diagram, but of course there's a planetary level. Also thinking about, for example, the ecological impact of digital technologies and how we might sort of think about that and integrate those concerns in creating digital artifacts. And also acknowledging that citizen or the user here is not singular, but interrelated with everything else. And approaching this sort of perspective to design, it helps us to move from the centering of smartness to care, empathy to compassion, expert to participatory, and creative, including co-creative, to recreative, that it could be, and it should be, with hope, recreated by others beyond the project, beyond us, beyond what we can see at the moment. And basically, we're talking about this. We have a bunch of cats in the group, including the Foggies and us at RMIT. And what we're really doing is sort of traversing between learn and play all the time. So we do have some ethnographic research component where we would look at domestic environment or the spaces where Foggies would engage with their creative practices, and that really matters, especially when we're talking about technologies, what kind of affordances it does provide and it doesn't. And we can go back to sort of design justice here, where we can see what structurally, what is afforded through design and what is actually importantly disafforded. So we'll be looking at those things, but also at the center of it is participatory design. And it's very interesting here is Tim Ingold and touched on and light as well anthropology or anthropological approach to design as a practice of observation grounded in participatory dialogue. So we are always constantly looking at what other things are possible, in this case, future technology, etc. And I will hand over to Kate.
So I suppose another really key suite of methods that we're trying to engage with, and I suppose to put it into context, there's an idea of somaesthetics, which rather than a framework or a methodology is kind of like a field of inquiry that's centered on the internal felt experience of the body. So it's a fundamentally subjective and of course difficult to, I suppose, document and apply field of inquiry. But for us with the Foggies, we feel like it's a really good match. And so, rather than undertaking a typical, I suppose, design project where we're working from the centre out and we're trying to create something that people kind of have to mould themselves into, we're trying to create a system or an experience where the system is kind of moulding itself to each individual. And so Soma aesthetics and Soma design is one way for us to do it. So there's kind of like a suite of methods that can be used, and most of them are kind of centered on developing sensory awareness of the subjective self and of the body as it moves in space. And there's a twofold reason for that. One is to then kind of share those experiences, so to create a vocabulary around those experiences to share with other people. And the other is to, I suppose, heighten your own awareness and appreciation of your sensory self by engaging in these kind of somaesthetic practices, which can involve, movements that feel good, breathing, and different kinds of activities like that. And our idea is to then engage some of this knowledge with pose estimation and machine learning models that can then mold themselves and learn about each individual Foggy participant to generate audiovisual responses based on their own unique physicalities, rather than creating a system that people have to kind of mold their physicalities to.
Oh, all right, that's a good start. Alan?
Sure. So some of the things that we would like to achieve with this is physical well-being, but also moving on from, so musical motions, our pilot project was very much about that, and it's becoming also co-creating an artistic tool that can be used with for these artists and others. We also want to promote this as an artistic tool that can facilitate social connection, and in a way that can be safe during times like this when we're not necessarily physically together. So we want to be able to facilitate that sense of social connection and creating artworks together in a way that where we can feel each other's bodies as well. Yeah, I'll pass it over to you, Jazz.
Yeah, great. And two other things that we will aim to do is a hybrid event with a public performance, but also documentation and guide. So we will document the process as it is a complex process, and also a guide for others who would like to do a similar project in the future, but communicated in a way that is accessible and easily understood and inclusive. So we can stop here. We could talk about this all day, as you do also about your projects, but I would like to open up to questions, if that's okay.
Great, thanks very much, Alan, Jazz and Kate. Wow, what a complex series of happenings. Creations, recreations.
Yeah.
Any comments or thoughts from audience members or other speakers today? We're all just stunned into silence. I guess what I'd like to know is, I don't know much about your Careful lab, Jazz, and others, Kate and Alan. But I'd be quite interested to know, and that was really interesting hearing about that particular project. Is there something you could also say about are you working on related kind of arts-based but / digital projects as well that complement what you've just talked about today?
Yeah, there are a number of people in different areas, and we take care as not just healthcare, but also, you know, in sort of we embodied it as a core value. So how we design, and there's a really interesting paper by Anne Light again and Yuka Kama, who describe designers as caretakers, and then how we can approach design differently. And so for us, that is something that we do or try to do when we design technologies, spaces even, or even artwork. So we do have a PhD student who recently joined also, who's looking at their experience, traumatic experience as a voluntary evacuee from the Fukushima incident. And sort of using urban spaces, but using yarn to create public or participatory art. But at the same time, the digital element is not coming right from the beginning, but later on. Now we're thinking about how we could communicate this, and also how we could think about different ways of engaging with the work. So there are always some digital elements, but it's not the starting point for us, I guess. And that's kind of like the Dan Hill's kind of, you know, diagram. Where do we start? And then technology usually almost always end up, you know, being part of it. So there are sort of aspects like that. And especially now we're bubbling up a lot in the creative practice area. We're multisensory kind of engagement. So Kate's work, PhD, and her professional sort of practice, absolutely. Alan's work recently about beescapes. I'm actually talking about your projects. So Alan might want to talk about beescapes. Would you like to?
Oh, sure. It's a virtual reality artwork documentary that allows audiences to see aspects of the world as if they had the senses of a bee, to gain insight into systems of nature that are invisible to us a lot of the time.
Yeah. That reminds me of something I heard yesterday on the radio about birds' nests and why they choose certain colours, and it's one reason is because they see in ultraviolet. Yeah, a lot of interesting stuff going on there. Now, Anna has a question. Do you find Peter Cooper's work useful? Or Cuppa?
It's Petra.
Sure.
Petra Cuppers. Petra Cuppers.
Well, it's spelled Peter here, P-E-T-A.
Oh, sorry. I'm a terrible typer. I really can't type, even though I type all the time. It's I'm just in I was wondering about the kinds of, you know, literatures that you find enlivening, and I was wondering about, you know, obviously Petra's work, or Leslie Roman, or who you are working with in thinking about the moving body and dance and disability.
That's a really fantastic question. So we're at the beginning of our project, and we've just engaged our RA to sort of undertake a more extensive literature review. At this point in time, a lot of our, I suppose, guiding mechanisms have been like our practice-led experience with the Foggies. And because the Foggies are our partners on this project, we are taking a lot of guidance from Nilgan and the disability support workers and the Foggies themselves in, I suppose, how we're approaching this. And so I think in the first instance, we have been working with the Foggies and with our engagement with them as our initial material. And I suppose the way I imagine this project unfolding is to then kind of broaden our research and kind of examine and explore what else is happening further afield. And then, of course, to kind of like draw that down into whatever our project ends up being by the end of it. Yeah, but that's a beautiful reference. I just really quickly Googled Petra. I'm not familiar with their work. So yeah, this is really fantastic. Thank you so much.
I think they're probably the main international figure in disability and dance.
Yeah.
But I think that there's a lot of work also coming out of I'm part of a UBC collective called Wingspan Disability Arts.
Oh, great.
That's out of the University of British Columbia. And I think some of the scholars that come together through that network are also useful. But also Andrew Benjamin in the UK. And there's a huge movement in the UK and a huge history of scholarship there. Kind of conceptual work on philosophy and the body and critiques of disability. So yeah, there's heaps of really exciting stuff.
Yeah, fantastic. That's excellent. Yeah, I'm really excited to look into I suppose what's being done further afield, because yeah, like I said, it's just been, I suppose, the direct experience we've been having with the foggies. Because when isolation happened, when lockdown happened, my mind kind of immediately went to the foggies, just because I guess I was so aware of like what a support space that is and how critical that space is for social connection, as well as respite for the family and the carers, the people around the foggies. It's that experience, that physical experience in space that the foggies have, each week when they meet up, is really entangled with everyone's well-being. And of course, everyone's well-being is kind of entangled with social connection. But of course, people with disabilities, I suppose, face a really unique set of barriers to engaging digitally with technology, setting up the platforms, having access to the technology, being independently able to access a lot of these systems. And so, yeah, I thought a lot about them, and then they got back in touch with me, and I actually ended up making a new video with them. I'll put the link in here. But it was compiled of all of their Zoom meetings. So they still met over Zoom throughout the entire lockdown and engaged in their performance practices, and actually generated an entire new performance based on all of the Zoom footage and stuff like that. So, and then that kind of, has fed into this project. We were like, well, how could we design a system that everyone could kind of have at home, that's super accessible, that's actually really like interesting for the foggies to use, to help them stay connected with these, invariably ongoing lockdowns that we're going to keep experiencing.
And I think it has a lot of sort of methodological offshoots and challenges. And Kate and I, and with Alan also, we're talking about this in terms of how we say participatory design, participatory research, but to what extent? And I think that's a really important question. And also just, we could never, ever, no matter, I mean, Kate's been spending so many years with foggies, but she would never say, I could tell their story, because it's theirs to tell. And how do we then make sure those stories and views and hopes and even fears are integrated into what we're designing together? And talking about sort of soma aesthetics and using bodies to sort of start off a lot of workshops, and that's very different to other participatory work that we have been doing with young people with refugee backgrounds, or about trauma, a sort of thing, which we do not, absolutely. And we care about artifacts used in the processes and spaces of where participatory design activities take place. So, loud sound and things like that, we don't engage with, and a lot of lights and things. We always have to think about these too. And even activities, the content of the activities for engagement, things like with other groups that I briefly mentioned. We would start with cultural probes, actually, creative kids, where they could take that away and tell their stories in private ways in a safe environment first before coming to the workshop, and that gives us the opportunity to get to know them before trying to do anything with them. Or when they arrive, we do particular activities like timelines of their particular part of their lives, and to see what the boundaries are in terms of them wanting to share. And we start from there to build, as Kate mentioned, sort of this shared vocabularies so that we could talk together in different ways, whether it's bodies or images. So for us, it's not just about understanding them or describing them, but working together and also designing processes as well as the final artifact.
Oh, it's all really interesting. Thanks, Jazz, Alan and Kate. Thank you for that presentation, and thanks for your engagement too, Anna. You've given them some interesting dialogue and some references too there, which is great. But we'll now move on to our final speaker. Jess, Flore, are you okay to share your slides, Jess?
Yeah.
Now, can I just make sure I pronounced your surname correctly?
Oh, it's Flore, but it's
Oh.
totally fine. I am used to all sorts of different versions of my name. It's fine.
Yeah, I was pronouncing in a sort of Italian way or Spanish way, I suppose, but you know,
yeah, it's
my guess.
complicated origins.
Okay. Well, please, we can share. We can see your slides. So please do. I'll just introduce you. Jazz Floor. She's from the Social and Global Studies Centre at RMIT. Another wonderful RMIT researcher.
Thank you so much, Deborah. And thanks for including me and for this introduction. It's a tough act to follow, but I will do my best. So my research focuses on lived experiences of mental health and mental illness. And I have a particular interest in how technologies, including automated systems, are transforming how people both understand and experience states that come to be known as, mentally healthy or mentally unwell. So I'd like to begin by acknowledging the Woiwurrung and Boonwurrung language groups of the Eastern Kulin Nations, on whose unceded lands I have the great privilege to work and live. I respectfully acknowledge their ancestors and elders past and present. And I would also like to acknowledge the traditional custodians on whose lands workshop attendees are located. So thanks for staying until the end of the workshop. And I know it continues to be a challenging time for everyone. And the news in Melbourne yesterday was particularly devastating, but let's press on and see what happens with our lives. So my presentation today will talk a bit about a pilot study that I'm currently conducting. The study focuses on young adults aged 18 to 25 and their uses of smartphone apps and wearable devices for their emotional and mental health. And I'll mostly be sharing with you the approach and a few key findings as they relate to participants' use of apps, because so far that's the technology that has dominated the study. So I'll start by providing a bit of background that many attendees will already be familiar with, because much of your research has inspired my own. So apps are becoming increasingly popular tools to monitor and manage mental health, but there is a lot of slipperiness between what is and what isn't a mental health app. One of the difficulties in studying those practices for mental health is that many are not designed specifically for mental health, but they become used in that way, or programmers and producers will claim that the apps can help in some way. So one of the examples that came to my mind when I was writing this is an ad that I'm continually seeing on TV at the moment for Noom, the healthy eating app. And the app claims to use a cognitive behavioral therapy approach to helping people eat better and diet. And it routinely refers to its services as supporting both mental and physical health. There's also a lot of research demonstrating that people commonly use apps designed for menstruation tracking or sleep tracking for their mental health. And this is definitely something that a lot of people who've participated in my pilot thus far have talked about. So we are talking about a very broad and nebulous group of apps. Adding to the complexity, of course, is the fact that definitions of mental health and mental illness exceed their diagnostic boundaries. People do not need a diagnosis to use an app, and they routinely reproduce and challenge the language of clinical diagnosis when describing how they use apps. Issues are further compounded by the fact that app production is big business. It can be very lucrative for large companies and startups to produce and distribute apps for well-being. While most are free, others have in-app purchases or require a monthly or yearly paid subscription to use particular functions. And I will come back to that point towards the end of the presentation. These apps have increasingly applied principles of machine learning and artificial intelligence in their design. Since the COVID-19 pandemic, some clinical psychiatrists have called for these applications to be expanded and accelerated, not as a replacement to traditional therapeutic relations, but as an added support to an extremely stretched system. It should be said, though, that these calls are often made in reference to people living with formal clinical diagnosis. This but this misses a large segment of people who use apps without a diagnosis or without any contact with mental health services, but still talk about themselves as having mental health challenges. I'm also aware that there is a lot of hype around mental health apps. They're fueled often by private corporations who see the opportunity to amass and process large amounts of data on people's mental health, ostensibly for improving services. In addition, this call to app is reproduced by some researchers in clinical psychiatry. So Thomas Insel is a very well-known clinical psychiatrist, and he wrote in 2018, the smartphone offers us an objective and ecological source of measurement. This approach, now called digital phenotyping, is based on sensors, voice and speech, and perhaps more important, human-computer interaction. The narrative is very similar to the early promises of neuropsychiatry. And in this case, digital phenotyping and its often accompanying concept, computational psychiatry, are presented as holding the potential to reveal objective measures on people's mental health. So the background itself for the pilot is quite complex. There are financial, political, onto-epistemological dimensions that drive how apps are being developed. And I think that these also impact how people use the apps and to a certain extent how they come to understand their mental health, what it means to them. So the pilot takes a more than human approach to technology and mental health, informed by STS and feminist new materialism. I can't delve in depth in the theory today. I could at another time, but a guiding principle that I'm drawing on here is that mental health and technology are entangled and co-constituted. They inform each other and they are produced through and with each other. So it's an exploratory study where I'm endeavoring to identify some of the key issues that are emerging in mental health apps among young adults. I'm trying to gather data on how people are using apps, what drives their usage, how and why they abandon them, because they often do, and what functions frustrate or entice them. The focus on young adults is not only out of personal interest, it's also because several studies in media and communication and in sociology have shown that young adults rapidly adopt and sometimes equally rapidly abandon emerging technologies. This group is also often a target for health app developers. And they've also been arguably greatly affected by government restrictions during COVID-19. They're more likely to work casually and bearing the brunt of the restrictions. It is something that quite a few participants have shared with me, that they have lost work during the restrictions. So they're more likely to turn to apps for mental health care when other avenues are constrained, in part because apps are already part of their digital everyday. So I'm less interested in questions of whether apps would completely replace in-person support settings within or beyond clinical spaces, or whether they actually do truly alleviate identifiable clinical symptoms, because the way people use apps for their mental health is very messy. So instead, the question in all its very, very layered complexity would be, what are the emotional, socioeconomic, political, and cultural contexts in which young people use apps that apply technologies such as automation and artificial intelligence for their mental health? And how did COVID-19 shape how young adults use apps for their mental health? So my methods are quite humble. It is a pilot that I'm doing as part of my fellowship, so I am doing it by myself. And so I wanted to find methods that could both, that I was both comfortable with, but also could sort of elicit what sort of other methods could emerge should this become a larger project, which I would love to do. So I've decided to go with a photo elicitation and followed by a narrative interview. And this is a screenshot that one of my participants sent me. When I was designing the study, like so many people, the aim was to do fieldwork in person and ask participants to reenact some of their interactions with apps. But while preparing the ethics application, it became very clear that lockdowns were fated to be more frequent, and I needed to adapt the methods for remote data collection. So I needed a method that would preserve some of the digital ethnography while not being too onerous on participants. So for the photo elicitation, what I typically do is I send participants some very brief instructions that gives a lot of space for them to do what they really want to do in terms of taking screenshots of their apps. The screenshots are meant to be meaningful to them in relation to their mental health. It can be a particular function that they like or dislike, or a significant event that they would like to discuss during the interview. Now, what I've noticed is that not everyone waits 2 weeks or does it over 2 weeks. So I give them 2 weeks to send me the screenshots. And at the start, that really concerned me because I thought, or maybe they're not really engaging with the sort of brief instructions that I'm giving. But I found that with photo elicitation, when it's followed by an interview, there's a lot of opportunity to discuss the photos. And some of them have actually expanded on photos that to me seemed innocuous, on the meaning behind the image. And they have also sent me photos after the interview, which is completely fine. So the interview is conducted about a week afterwards. It invites them firstly to share what mental health means to them, so we can kind of introduce the technology and tease apart what sort of tensions and connections there are there. And then there is an entire section devoted to COVID-19 lockdown, which is also something that I added just before submitting the ethics application, because again, it became clear that COVID was going to be with us for a very long time. So I wanted to share a couple of examples of discussing the photos during the interview. So that's me here. And this is a participant talking to me about Wobot. Wobot is an artificial intelligence chatbot that I also have on my phone. I experiment with it. I experiment with quite a few of them. This participant was very aware that AI was used in the app, and he mentioned that he liked it because the app remembered him, remembered what he said, and there was a context to each conversation. He viewed apps as neutral. He used the word neutral platforms, meaning for him there was less judgment and social pressure with no time-consuming, commitment needed. But he did mention that he was very annoyed with Wobot's limited conversational skills. He referred to the app as being stuck in a loop at a point where the conversation goes nowhere and the patterns of chats are repeated. One of the value of this came specifically during the lockdown, because there's a lot of stigma in his social network around mental health. So no one knows that he has an experience. And so he found the app user-friendly, available 24/7, which is something that he really needed during lockdown, compared to seeing a psychologist, which he found both expensive, available at very limited times, and difficult because he would need to leave his home to talk to his psychologist. And, it's Melbourne, it's windy, and connections are not very reliable. So the next photo is another participant. My background here, by the way, is my home country, beautiful Mauritius, the motherland, and our national anthem is actually called Motherland. So this slide is interesting because the question of cost came up quite a few times, because despite a lot of apps being free, some of them do have a point where you're supposed to pay for the service. So I think this app is called 10% Happier, and it's a meditation and mindfulness app, if I'm not mistaken. And it's interesting to me because there's such a great nexus of commercialization and care happening at the very bottom of the image, where you can save 34% today to get some mental health care. Now, needing to pay drove the participant to find a free app with no requirement for purchase. However, and this is where the variation is, another participant that I interviewed, and I don't have a photo of them here, but they decided to pay for a menstruation tracking app. The subscription unlocked the artificial intelligence functionality because for them, this was deeply connected to their diagnosis, and the ability to visualize their data and see patterns was extremely important for their mental health care. All right, I am on my last slide, so that's good. So the data collected thus far has revealed a really great love of data visualization based on AI. Many participants appreciate apps that enable them to see patterns of their mental health over time. So the data they generate and see are entangled with their understanding and experiences of mental health and mental illness. So one participant really, really evocatively spoke of not being able to trust their brain because of their mental illness. The patterns of data over time shown through visualization for them are understood to objectively represent their diagnosis. So as I continue to collect data, I'm working on what kind of methods could emerge and could be deployed in a larger project. I think it's interesting because journaling is such an old-fashioned practice, but a lot of participants really appreciate it, and the option of doing data diaries where they could reflect on visualization of their mental health data over time could be really insightful, and these could be photo-based, written, or narrated, although it seems like quite a lot of them actually do like writing on their smartphones. I'm also quite inspired by the methods that were discussed at the workshop last week, especially inviting people to write letters or postcards to or about their data. One of the things that I'm really fascinated by is why people collect multiple mental health apps and they become zombie apps. They're not used, but they're never deleted. When I brought it up with a few participants who said that they have those apps on their phone, it seems like firstly, they're worried because they don't know where the data is going to go once the app is deleted. But also they like the idea of having multiple archives of their mental health history that they can view every now and again. Asking participants to write to their data and break up with the app could be a creative and generative method for a larger project. So I'll stop here. Thank you so much.
Thank you, Jess. Yeah, well, it's great to hear that you got inspired by last week's discussions of methods. I'm hoping that there'll be lots of inspirations from these two workshops for people. And I should just remind people that we are recording both these workshops, and they will be up on the Centre of Excellence YouTube channel in a few days. So they'll be there for anyone to go back to or to share with others or students, for example. So let's see if there's any questions in the chat or comments. So Anna's said multiple archives is an interesting idea. Thanks, Jess. That was so interesting. That was a comment. Thank you, Anna. Anthony said, could you say some more about that last bit on people worried about losing their app data?
Yeah, definitely. Thanks, Anthony. This was interesting because it touches on the idea that people have some sort of notion that the data belongs to them, and once it's deleted, it will, I think they're worried about the ownership of their data in some limited ways, but at the same time, like they know that the app is doing nothing, but then they like the idea of revisiting their mental health history every now and again. I'm not sure if it's, for one participant, I can certainly say it was about viewing their improvement of like the kind of, mental health improvement over time. For others, it was more about the question of, well, I'm not sure where this is going to go. What will the company do with it? As though the company is not already doing something with it at the moment, if you know what I mean.
Did you want to come back, Anthony, and follow up?
Oh yeah, no, that's really useful. I'm kind of just, I guess, yeah, just interested in exactly that, like what they actually think data is, and in this case, yeah, it's interesting that it seems to be somewhere between the mythical idea of data that gets sold and is bad versus data as they're actually part of their journey and part of their actions, but also potentially to do with the analysis of that action, and all of those things are very different, clearly.
Yeah.
So it's almost a project in itself.
Great.
Well, there's lots to be expanded on, and I mean, as you know, Jazz, I'm really interested in how people make sense of their data, and I think it's really great to experiment with different ways. I mean, asking them directly about it, yes, that gets you some insights, of course, the old school way, but yeah, creative ways of, and I think really getting at that sort of more than representational dimensions that some other people today have discussed in relation to what people can't always articulate very well in words is something that I'm interested in too, and sensory methods that can really kind of get to those dimensions of people's experiences. I think there's a lot to work on there.
Yeah.
Here's Anna on the chat. She's saying, yes, the effect of a visual is so important. Thanks for organising today, Deborah Lutton. Thanks so much, Anna. Which is probably a point, we have gone a few minutes over time, but we've largely kept to time, which is pretty good, I think. It's always difficult. And we have had a few techie issues that's held us up a little bit here and there, but for the most part, I think it's gone well. And I've really enjoyed hearing everyone's presentations today and having discussions with everyone today. And I hope the presenters enjoyed it too. And I hope everyone listening in has enjoyed it. And thanks to all the presenters today and all the presenters from last week's workshop as well. And yes, just a reminder that everything will be up on our Centre of Excellence YouTube channel. So it will be there if you ever do want to go back and refer to it or share it with anyone else. So thanks again, everyone, and enjoy having a nice lunch and a break now, I hope.